Look, addiction centers, what they generally do is couple yoga um, with other modalities, right? So a lot of people get into yoga when they're trying to battle their addiction because they go to an addiction treatment center and they basically do yoga. And that yoga is really varied, but generally it's trauma sensitive. It's based on calming the nervous system, the things you'd expect, right? Um, but when you work one on one with an addict, um, what what I'm doing is usually twofold, and the first one is really looking at their, like we do in this course, at their doshas and really giving them practices to balance their doshas first. So that's sort of like the first order of business. So a lot of addicts are seriously pitta imbalanced, and so I work with that a lot, and then um, but then the sort of deeper work is more from a koshic perspective, where um, the way I look at it is we're trying to retrain their system so that their Vijnanamaya kosha, their unconscious mind, is not guiding their actions. So you can get into very deep work. So instead of the sort of, there's a part of getting out of being an addict, and I've been one, so I know this. Where you're just sort of gritting your teeth and, it works if you work it kind of thing. And that model's good, but it's only good to a point because it won't move you like beyond your addictions causing you to act constantly. So the next piece of work then is the stuff we're actually doing in this course, which is to really understand that those addictive tendencies are, even though they feel energetic and physical and all these things, we're actually working in the Vijna, in the unconscious mind. And the job really is to unearth those things. So a lot of philosophy, a lot of practice, like physical pranayama, all to get sort of even doshically, but then we like really dive in and try to change how we interact with our system. And the practice of yoga, in a way, is really getting unaddicted to your thoughts, is a large part of that practice. And you could say that many ways, right? Like you could also say it's getting unaddicted to reacting to your thoughts. But either way, we're all addicts. So when I've worked with addicts, I like working with addicts one-on-one more. I've done class work in my life, and I like that because more of a, it helps, and I like to give people hope in that way, that practice can bring them relief. But the other thing, which could be super controversial, so I'll just preface this with that, is that not all addicts want to be unaddicted. So, as a yoga therapist, your job is to give people the chance to investigate whether they do or not. And then what you usually find out is who is really interested in changing. And that's true of everything, but it's in starker relief with addiction.